We often see these graphs in hospital scenes and movies, but what do they mean and what are they telling about one's heart health? To better understand our topic, let's discuss ECG and EKG grid paper and normal EKG rhythm. It's also important to remember the terminologies depolarization meaning contract and repolarization meaning relax. ECG grid paper, each small box represents 0.04 seconds, and 5 small boxes comprise one large box equals about a fifth of a second or 0.2 seconds. By counting these boxes, we can measure the timing of each part of the ECG rhythm. Now let's look at the dashed lines at the top of the ECG strip. Each thick hash mark represents 3 seconds, and the space between 2 thick marks is 6 seconds. This helps us calculate heart rate and analyze rhythms. Here's an interpretation of a normal sinus rhythm and what's happening in the conduction system of the heart. Let's start with the isoelectric line, the neutral or no charge. Everything above it is positive and below negative, but it depends on what leads are used. But for the discussion, we are mostly going to use lead 2. Then the electrical signal begins in the SA node, or the pacemaker of the heart, and travels through the atria, and this is called the P wave, representing atrial depolarization. And only then it reaches the AV node, which acts as a gatekeeper and allows a delay to happen, ensuring the ventricles fill before they contract. After 120 milliseconds, the electrical signal will pass through the bundle of His and into the left and right bundle branches. It will then pass into the Purkinje fibers causing ventricular contraction. This is the QRS complex. Finally, the relaxation of the ventricles, which is the T wave. From this, we can determine the PR interval by measuring the distance between the start of the P wave to the beginning of the QRS complex, and then the interval of the QRS complex, which starts at the Q wave and ends at the S wave. We are ready to dive into the 5 steps to interpret an ECG and EKG strip. These steps will help you analyze any rhythm. Look for the P waves and a QRS complex. Is the P wave present and upright? Does each of the QRS complex have a P wave? An abnormality here can be an indication of some sort of problem. Next, we have to measure the PR interval and the QRS complex. Abnormalities here can indicate heart block or other issues. PR interval normal range is 0.12 to 2.0 seconds. QRS complex normal range is 0.06 to 0.1 seconds, up to 0.12 seconds. Use calipers to measure the boxes. Step 3. Check whether the R waves are regular or irregular. Use pen and paper or caliper. We will then determine if the R waves happen in a regular rhythm. Mark the first 3 R's, and if all the R waves align, this is irregular. Step 4 is we determine the heart rate. Most of the time, heart rate is availability digitally on a heart monitor. However, we can also determine a heart rate by counting the number of R waves in a 6-second strip, then multiplying it by 10. And we know our normal heart rate is 60 to 100 beats per minute. Take this strip for an example. It has 9 Rs. Multiplying it by 10, we would get 90 beats per minute. Interpret the rhythm. In steps 1 through 4, we use a normal sinus rhythm as an example, but there are a lot more rhythms that we can be determined from the ECG strips. This includes a rhythm of AFib, VFib, SVT, or supraventricular tachycardia.
Thanks for watching. If you found this video useful, don't forget to like, share, and subscribe for more medical information, and to really help you on your next exam.